In this video, I'm going to demonstrate neuromuscular techniques. You can use these effectively to target trigger points, reduce hypertonicity, and restore optimal function in your client's muscles. In this short video, I'm going to demonstrate a neuromuscular technique, or NMT. So with my client on the couch, I've done a thorough back massage, and we've gone through all the different techniques to warm this area up. So we've gone quite deep. If you're still unsure about lower back massage, have a look at my previous videos, or we'll put a link in so you can have a look how to warm the back up. But once we've got to that position, I found quite a tight area down here, and my client has commented how it does feel quite restricted. Once I've found this area, what I'm going to do is I'm going to put some deep pressure through that area. Now, on a pressure scale, I explained to my clients about 1 to 10. 1 they can't really feel, and 10 is excruciating. And we all know that massage should not be painful. I'm going to take my client up to a 7 or 8, and I'd explain the 7 or 8 pressure scale as a, oh yeah, I can just feel that, yeah, but I don't really want any more, is how I would talk about 7 or 8 pressure. So we're going to get in. Because I've already got some lotion on there, I'm going to work through towel, and it's as effective through towel but no slip. So let's have a little feel around this area here. I'm going to reinforce my thumb to start with. I'm going to apply my body weight down through straight arms into that area. Okay, and my client on the couch, I'm going to get some feedback on that pressure scale. What are we there?
It's a good 7.
It's a good, I'm happy with a good 7. Now you can see my thumbs have gone a little bit white, and I don't want to aggravate my thumb joint. So once I've found this area, what I can do is replace it with an elbow. So again, I will need to check the pressure, make sure that we're not working over the vertebra. So we're here on the erector spinae here. I'm going to apply that pressure through and get my client to tell me again. Are we still on about 7? Okay, brilliant. So we're going to hold that pressure. And while we're there, my client is now going to do 3 slow, long, deep breaths. So breathe in. That's it. And out. When you're ready. It's got big lungs. That's good. We just keep that pressure on for 3 slow, deep breaths. That's good. One more. This is engaging the client with the technique, getting them to concentrate on this area. It's engaging the nervous system. Okay, and just breathe normally for me there. Does that feel like it's reduced at all?
Yeah, no more than a 4 or 5.
4, brilliant. So we've gone from a good 7 down to a 4, which is what I would expect with a neuromuscular technique. Now, after any deep techniques like so, let's take this back. You can see a little bit of erythema where I was working. Okay, erythema we know is reddening of the area due to an increased blood supply. So let's soothe that area off. So it's engaging the client, which we need to do in our massage treatments. If the client is always lying on the couch and there's no communication and they don't move, then they're going to get up and they're going to feel stiff, and things are going to feel painful. By getting them to do deep breathing, engaging with techniques, helping with stretches is the best way we can work with our clients on the couch. Now I could repeat that again, slightly below or slightly above where I find these tension areas. We can use NMTs anywhere in the body where we find this restriction. Other good places for it are up here on the traps. If you come and have a look where I'm pointing, yeah, just here in between the shoulder blades. Also here around piriformis area, bicep femoris, and often here in the calves on the medial lateral heads of the gastrocnemius. So just to recap, NMTs, really effective to engage the client in the treatment. It gets them to relax through using deep breathing techniques. Once we've found this area of tension, we apply some force through it, whether it's with thumbs or an elbow. We get them to rate the pressure out of 10, and once we got to 7 or 8, no more than 8, we get them to do 3 slow deep breaths. After that, let's get some feedback on the pressure. And clients often say it feels like it's melted or they can't feel it anymore, which is perfect. After that, we're going to soothe off and we're going to carry on, and we potentially could be finishing our treatment after these deep techniques, but make sure we do lots of effleurage first. Please drop me a comment below if there's anything else you would like to see. And don't forget to like, share and subscribe. See you on the next one.